So what does happen during a consultation? Well, if it's a video consultation, we do that through a secure link. It's very helpful to have photographs being sent if you're comfortable with that. And that enables us to have a really good idea and a good conversation about the principles about what you're interested in. An in-person consultation, of course, allows much more depth to be covered, as well as the key, thorough clinical examination. And that really is absolutely crucial because everyone's tissues and bodies are quite different and they may behave differently with different procedures, and I need to be able to examine you to understand how I think you may benefit from a particular procedure. We then have an opportunity to go through the risks, the process, the likely outcome and recovery, and I provide lots of information for you to read prior to a further consultation where we can see each other again to go through things once more and then take things forward for surgery. The patient journey really refers to the whole process from the moment you pick up that first phone or write that first email to me, my practice, or at Purity Bridge, right through to the very end of your recovery process. And we want to make that journey as supportive and effortless for you as possible. We don't really want you to worry about things. We want you to find us being very receptive and very easy to access and to consult with both myself, my nursing clinical team, and also all the back office administrators who do so much, be it my secretary, practice manager, receptionist, and so on. So we're here for you. We want to make that journey as seamless as possible, and we want to effectively carry you from the start to the finish to make that as comfortable as we can for you. Medical photography and video is a crucial part of the consultation process and indeed of your medical records. It not only is better than any drawing or description that I could make, it also is a great reference point and something that we can analyse and study to really appreciate what the situation is before surgery and then act as a comparator after surgery. Just to reassure you, I only ever use patients' photographs and videos online or on my social media if they've given express permission for this. So it's certainly not an automatic process that videos and photos are uploaded. But they do form an invaluable part of your records and an invaluable resource for further future reference. On the actual day of your surgery, you'll be coming to the hospital or perhaps to the clinic prior to the surgery. If it's a hospital, I usually want you to be there very early, so I have plenty of time to sit down, talk through things again with you, and have plenty of time for that crucial planning and drawing. All the drawings and mapping out on you that is so crucially important prior to any plastic surgery procedure are done on the morning of surgery. It then means that I can concentrate on operating for the rest of the day without having to worry about another patient coming in to see me halfway through the day and then later on. So it really allows me to focus on you at the beginning of the day of surgery. You then will have a variable weight, depending on where you are on the operating list, to come down to the operating theatre later on that day. You'll be made very comfortable and looked after very well by the nursing staff during that wait, and surgery will be ready for you before you know it. I've really put in place a very specific post-operative journey for all my patients because it's so important that not only do you have regular appointments with myself, my nurses and the other members of the team, but also that you have easy access, and if you've got any concerns, any worries, you know you can pick up the phone or get in contact with us anytime to allow us to see you or speak to you as and when it's needed. So normally you'll be seen around a week after surgery, 2 weeks after surgery, then perhaps 4 to 6 weeks, and then beyond that it'll be several months later. But I do like long-term follow-up. I like to see how you are doing, how your results are settling down, but also easy access so we can see you in between times whenever is needed and whenever is appropriate. So aftercare is absolutely crucial to be very supported the whole way through. The best way to get in contact with myself or the team after surgery initially is through the phone. The best thing, if it's early after surgery, is to phone the hospital or facility in which you had your surgery, and they'll be able to get hold of me 24 hours a day. If it's a more routine question, such as should I stop wearing my bra at a certain point, when can I start massaging, it's easy to send an email. We can always wait till appointments for certain questions, but I'm very happy to be contacted at any time to help answer those questions, and I don't want you worrying about anything or having any little niggles that are of concern. So do feel free to get in touch anytime. We're very accessible, and that's what we're here for, here to help. It's important that every part of plastic surgery is as safe as possible, and that is particularly relevant when it comes to elective breast surgery. For that reason, anyone who is 40 years old or over who's considering elective breast surgery really should have a mammogram taken ideally within the last year as evidence that they have a disease-free breast, or as best as we can estimate a disease-free breast. As a plastic surgeon, I never want to be in the position that I am partway through an operation and I discover something that looks sinister or shouldn't be there. So having that mammogram before surgery is absolutely crucial, and it also allows a reference point for any future subsequent mammograms.